The feds have been under a lot of scrutiny over the number of vaccines that have arrived in Canada so far. Now the NDP is calling on the government to play a bigger role in getting Canadians vaccinated, including involving the military in those efforts. The NDP also wants to see vaccination sites set up in federal buildings. For more on that plan, we've reached NDP Leader Jagmeet Singh here in Ottawa. Hi, Mr. Singh. Good to see you. Thank you for making the time.
My pleasure, Ms. Capellos.
I want to start off on your vaccine plan that you unveiled today. CBC's own vaccine tracker shows 89% of the vaccines that have arrived in Canada have been used by provinces. Why are you advocating for more federal involvement in what the provinces are doing if they seem to already be doing it well?
Well, our concern is that we've got a country of almost 38 million people, and it is a colossal job to get everyone vaccinated. We need to do a lot more vaccination. There's no doubt about it. We are lagging behind other countries that are far smaller economies than us that are vaccinating more people. So we need to increase access to dose, but we also need to make sure everyone gets vaccinated. Delays in vaccination literally mean more people get sick and more people die. So we want to put all hands on deck approach. Everyone needs to be involved in getting vaccines into people's arms.
But respectfully, Mr. Singh, there are two separate things. I understand the federal government's role and your criticism of it when it comes to procuring the supply of vaccines, but that supply is being used right now by provinces. What evidence do you have to suggest that the federal government's involvement in administering doses of vaccines, a role the provinces would normally occupy, would better serve Canadians?
Well, we just need to look at this as everyone that can provide help needs to be providing help. We look at the states, and President Biden just deployed 1,100 soldiers to assist in the vaccination. We should leave no rock unturned. We need to do everything possible to vaccinate. That's a huge number we've got to get to. 38 million Canadians. Everyone's got to get vaccinated. It's going to be a colossal, monumental effort, and we should not in any way limit all the options available. So that I'm saying, let's get a federal vaccination site set up across this country. Let's have Canadian forces assisting. Let's have an all hands on deck approach because we're nowhere near where we need to be in getting people vaccinated.
When it comes to the suggestion around the military, Dr. Theresa Tam, Canada's Chief Public Health Officer, was asked about your suggestion today. She said that human resources isn't the biggest concern for the rollout. Again, what evidence do you have to suggest a higher level of involvement from the military would better or faster get vaccines into Canadians' arms?
Well, I'm just looking at the realities, and I'm looking at the stories that I'm hearing and people telling me about the pain that they're experiencing right now, the fear they're experiencing. A gentleman that I met whose father was recently admitted into long-term care, who ended up getting sick with COVID-19 and ended up passing away, and how he keeps on thinking, what if my dad was vaccinated? Maybe he would still be here. I want us to look at this as a national effort. We know that this is serious, but I don't see that same effort being put forward to match the seriousness of the goal of getting every Canadian vaccinated. We just heard from Justin Trudeau today, and there's a disconnect. The seriousness of the problem, the pandemic that we're going through, the lockdowns, businesses that have been shut down, how hard this is on people, and the lack of a response at the federal level. It's not proportional to how serious things are. And I'm saying we need to do everything possible. Let's not dismiss any idea that's going to increase the ability to get people vaccinated.
But with respect, are you conflating the issues? Like, are you dismissing what Dr. Tam is saying? She's saying human resources right now are not the issue, that the Red Cross has volunteered, for example, to help, that the military already is helping in distribution when it comes to Indigenous communities. Like, what evidence do you have to support the suggestions that you're making that the stuff you're saying is actually going to make things better for Canadians?
Brazil, Morocco, Indonesia have delivered more vaccines into people's arms than Canada, one of the world's largest economies. We are far below smaller economies in getting people vaccinated. This Liberal government is failing. It is clear we are one of the world's largest economies, and we are failing behind smaller economies that are getting more people vaccinated. That is ample evidence to point out when people say they're worried and afraid, it is borne out in the evidence. There is simply not enough vaccination happening, and we've got to do everything possible to change that. And I think this is a desperate situation we're in. I want the vaccine to succeed. I want people to be safe. I want their loved ones to be safe. And I don't think being caught up in jurisdictional disputes, as the Prime Minister is, versus showing some leadership and saying, let's federally fund an additional avenue to get more people vaccinated so we can get that goal of all 38 million Canadians getting vaccinated. It's a serious thing, and it requires a serious effort. And I'm not seeing that from Justin Trudeau right now.
I certainly take your point on concern from Canadians around how fast or lack, how fast it's not happening. But that is really with respect to the procurement of the supply, right? It's because it's not as though provinces aren't getting them right now into people's arms. I'm not saying that isn't necessarily possible in the future. But right now, like I said, 89% of the vaccines that have arrived here are getting into people's arms. The problem that you're highlighting is one of supply. So how does overriding the jurisdiction of provinces help with that? It doesn't, does it?
Well, I want to be clear. I think right now we're up against a procurement problem. Absolutely. But without a clear plan to getting people vaccinated, we will be up against a delivery problem in the future. I don't see a plan put forward right now by the federal government that's going to help us get to that point where we can get everyone vaccinated. And why would it hurt to have an additional venue to get people vaccinated? And we're saying this is a federally funded idea, to have it completely funded, have a federal funded vaccination site set up that are staffed and provide another way to get people vaccinated. We need to look at this as the monumental effort it is. It is not a small feat to get everyone in our country vaccinated by September. That is a laudable goal. But right now, I don't see the federal government, A, getting enough procurement, but B, even if there's enough procurement, what is a path to getting all those people vaccinated? We need to look at being proactive instead of saying, okay, well, it's not a problem right now. Well, procurement is a problem right now. What if tomorrow the problem is getting that delivery into people's arms? I want us to be prepared ahead of time instead of scrambling after the fact. Then we say, oh, now it's a problem, but there's been no effort put in place. Let's put the planning in now, make sure we've got ulterior ways to get people vaccinated, and provide one option through the federal government.
Mr. Singh, before I let you go, I do want to ask you about one other topic, and that's China, and specifically the Olympics. The Conservatives today calling on the federal government to push for a change in location for the 2022 Olympics in Beijing, focused on their contention that what is happening to the Uyghur population in China constitutes genocide. Is it your position and the position of your party that what has happened and what is happening to the Uyghurs does constitute genocide?
There's certainly ample evidence that suggests that what's happening is genocide to the Uyghur people. But in addition to the Uyghurs, there's ongoing concerns about human rights violations, concerns about Mr. Spavor, Mr. Kovrig that have been detained in horrible conditions for so long. There's some serious concerns about human rights. And I think that that's a fair call to say we should relocate. But my focus is on getting the vaccine to people and making sure we have enough supply and enough mechanism to get that in people's arms. That's really my focus.
Just to be clear, though, Mr. Singh, you would call what's happened to the Uyghurs genocide?
I think that there's ample evidence to point to that. And I think that's something that a lot of experts are pointing to. I think we need to take it very seriously. The treatment of Uyghur has been horrible. There's been massive human rights violations. And I think there's mounting evidence that experts are saying would lead to a determination of genocide. And
has your party made that determination?
We haven't formally stated that, but I think there's a lot of evidence that make it really clear that the evidence is mounting that to make the case of genocide. Will you formally state that? We will get back to you on that. That's something that we can absolutely inform you of.
What makes you hesitate to say it now?
Oh, I think that there's certainly what's going on against Uyghur people, to me, meets the definition of genocide. We haven't taken a position as a party, but I absolutely believe that that's what's happening there.
Okay, I'll leave it there. Thank you so much, Mr. Singh. I appreciate you making the time as always.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.